Working on mental health should be a mental process, right? With most approaches, it is, but not with somatic experiencing therapy. Somatic experiencing therapy is a bottom-up approach that starts with your body, not your brain. The focus for this approach is what is happening in your body in the present moment. How do your emotions feel in your body? Where do you notice tension? What does your body want to do? But how does focusing on your body help your mental health? Isn't it just the brain that matters and the body is along for the ride? Actually, the body plays a major role in experiencing, learning, remembering, and processing life events. The brain and body work together to create a full experience of life. The brain processes the meaning of situations, while the body processes the raw emotions involved. If the emotional processing gets overwhelmed and shuts down, those emotions can get stuck in the body. So even if your brain moves on, your body still carries the emotional baggage. Let's say that when Annie was 16, she was in a car accident in which the car flipped and she was pinned inside the car. Although she didn't suffer any major injuries, she was trapped for 45 minutes until help arrived, completely unable to let her body do what it wanted to do and bring her to safety. Now Annie is 40 years old, and she's playing with her 10-year-old son, making a blanket fort. And because her son is a bit of a stinker, he jumps on top of the fort and collapses the blankets right on top of her. Within an instant, Annie goes from playful and happy to a full-blown panic attack. And although she hasn't thought about the accident in years, her body instantly starts to feel the same experience of being trapped, and her brain is flooded with vivid memories of the car crash. In Annie's body, the trauma from 24 years ago is still active and unresolved. So when a similar feeling of being trapped comes up, her body panics, even though her brain knows that everything is fun and games. When working with Annie or any other client, the somatic experiencing approach focuses on the energy and sensations within the body in order to connect to and release pent-up emotions and to introduce a felt experience of calm and safety. To do this, there are 4 main steps to the therapy process. The first is to learn skills to recognize when your nervous system is overloaded, and then to soothe and relax your body. Then these skills will allow the individual to unblock, process, and release frozen emotional experiences. From there, the aim is to create new experiences of safety and flow within the body. And finally, neural pathways in the brain will be generated as new meanings are discovered related to bodily experiences and their ties to emotions and thoughts. In a somatic experiencing therapy session, it is common to be asked to pay close attention to how emotions present themselves within your body. Maybe it's heaviness in your stomach, a flutter in your chest, tightness in your jaw, or a clenched fist. Your therapist will then help you stay with the sensations and see how it shifts and changes and what action impulses arise. The idea is to follow the natural wisdom in your body as it processes and heals, rather than trying to control or impose from the outside. Fundamentally, somatic experiencing is designed to treat trauma that is trapped within the body. This includes PTSD as well as a host of other conditions in which trauma is the underlying factor. In summary, somatic experiencing therapy is a bottom-up approach in which the bulk of the work is done by recognizing how felt emotions within your body are tied to thoughts and cognitions. The goal is to release and integrate stuck emotional experiences and ultimately to regain a felt sense of security.